Whooping cough. Bordetella pertussis. Summary. Whooping cough, also known as pertussis, is a communicable disease that is extremely contagious. Men, women and children of all ages may contract whooping cough, though it is most harmful to newborns and infants. Whooping cough only affects humans and is transmitted person to person by droplet transmission, by coughing or sneezing in a shared breathing space. A mother is concerned by the way her 5-month-old daughter is coughing. She brings her baby to the pediatrician. While the doctor examines the patient, he hears a familiar cough and recommends testing the baby for pertussis. The doctor explains that a sputum sample will be collected via deep nasal suction and sent to the lab. The baby will also be sent to radiology for a chest X-ray to rule out any other disease processes that could be going on in the lungs, such as pneumonia. Let's go way back to when the doctor was in medical school. Pertussis is commonly known as whooping cough, is caused by the bacteria Bordetella pertussis. It is a respiratory disease marked by severe, spasmodic coughing that causes a whoop sound during inspiration. Two of the most dangerous complications is pneumonia and acute encephalopathy. Newborns and infants under the age of 4 months old are at the highest risk of complications to pertussis, including death. Structure of Bordetella pertussis. Structure of Bordetella pertussis. Small gram-negative, strict aerobic cocobacilli. Size 0.8 microcyn by 0.4 microcyn. Encapsulated. Does not produce spores. Arranged singly or in small groups. Bordetella pertussis virulence factors. Adhesins. Filamentous hemagglutinin binds to sulfated glycolipids on ciliated cell membranes and initiates phagocytosis. Pertussis toxin binds to glycolipid on surface of ciliated respiratory cells, and to the ganglioside on the surface of phagocytic cells. Bordetella pertussis virulence factors. Toxins. Pertussis toxin inhibits phagocytic killing and monocyte migration. Adenylate cyclase/hemolysine toxin inhibits phagocytic killing and monocyte migration. Tracheal cytotoxin, a peptide dog-liking fragment that kills ciliated respiratory cells. Lipopolysaccharide activates alternate complement pathway and stimulates cytokine release. Aromonecrotic toxin, a highly lethal toxin which causes inflammation and local necrosis adjacent to where the Bordetella pertussis is located. Pathogenesis of Bordetella pertussis. Pertussis is transmitted via droplets. Multiplication of the bacteria in the mucous membranes of the respiratory system is rapid. Attaches to the cilia cells of the respiratory tract. Bacteremia does not occur. Pathogenesis of Bordetella pertussis. Disease occurs in 2 stages. First stage is colonization is the upper respiratory tract, with symptoms including fever, malaise and coughing, which will increase in intensity over a 10-day period. Second stage is the toxemic stage, which follows relatively non-specific symptoms of the colonization stage. It begins gradually with a prolonged and paroxysmal coughing that often ends in a characteristic inspiratory gasp, whoop. Here is a 2-week-old with pertussis. https://uta.be/vx98i4. Pertussis host defenses. After an infection of whooping cough, the host will build an immunity that may last for years against recurrent infections. Second infections in adult years may have atypical symptoms. Pertussis toxin is assumed to be one essential protective immunogen. The defense mechanisms are both nonspecific and specific. Nonspecific local inflammation, increasing macrophage activity, and production of interferon. Specific proliferation of B and T cells. Bordetella pertussis epidemiology. The mucous membranes of the human respiratory tract are a natural habitat for Bordetella pertussis. Bordetella pertussis can survive outside the body for a few days, and may be transmitted by contaminated objects. Most infections are transmitted via direct contact with infected person. Whooping cough is a highly communicable, worldwide infection. Once killed thousands of children per year. Widespread vaccination has caused continuous decrease in transmission and mortality of the years. Neither season or climate affects the transmission and mortality. Diagnosis of whooping cough. Whooping cough can be diagnosed a number of different ways. A sputum sample can be collected via nasopharyngeal deep suction on infants. The sample will then be cultured to see if the Bordetella pertussis bacteria is grown in the lab. Diagnosis of whooping cough. Bordetella pertussis usually grows in after 3 to 4 days at 37 superscript OC. Small transparent colonies form. Treatment and control of pertussis. There are a number of antibiotics that can be used to treat pertussis, but the one most recommended by physicians is erythromycin. The treatment, however, has no influence on the course of the infection. It only removes the organism from the respiratory tract. A patient treated with erythromycin will only be contagious for 5 to 10 days. The disease is preventable if you receive the vaccine TDAP or TAP. 5 things you should know about whooping cough, from Lee Memorial Hospital Health System. https://uta.be/y_56rs80. The end. Thank you for watching. Jordan and Kristen.